resident from University of South Florida. And this was part of my Master's of Science in Public Health thesis project. I was interested into knowing how the implementation of Affordable Care Act, especially pertaining to small businesses, will affect health and safety of our workers and also the businesses. So I do want to thank NIOSH ERC grant for funding my study and also for my thesis. And I don't have any conflict of interest to disclose. All right, so these are the objectives for this PowerPoint presentation. We'll go through introduction, methods, results, discussion, and conclusion. So a little bit of background information. So since 1965, when they first started with the Medicare and Medicaid, we haven't had any changes in the healthcare system in the US until the recent implementation of Affordable Care Act in 2010. So I'm mostly going to focus on the aspect related to businesses because that's what we're here for. So how it's going to affect, based on the laws right now, the goals are to help small businesses, even large businesses, to focus on prevention, safety, and well-being of the workers. So as an ACMED physician, I think that's a great idea. However, it's a new law, there are issues, and some people might not like it, some like it, we don't know why. So that's why we did the study. So there is controversy, most of the small businesses, according to if you go to the Affordable Care Act facts website, they will say their intent was to help small businesses to be able to afford insurance as opposed to, large businesses who have the monetary resources to do it. So small businesses, 50%, they did a poll in 2013. The owners thought it's not good for them because they will end up paying more premiums, and also because because of that they decided to cut down hours of full-time employees or not to hire new ones. However, it's supposed to help. So we thought, well, why not just give it some time to see if the policy is going to help or not. Let it, once the implementation occurred, to see which direction it's going to go, because nobody knows. So we decided to focus on perception because that's important. It has a huge influence on your behavior. So whether you're going to like it, not like it, purchase it or don't, your perception matters. And the definition, perception, is what your sensory processes, and then you kind of sort that information and interpret in a way in your brain based on your, these are the influences of perception, like your personal, experiences, your past experiences, or also other factors like job status, age, race, gender, etc. And there are studies which I can talk to you about later, but that looked at each individual socio-demographic factors to see how, based on those factors, their perception will be affected regarding the law. However, the problem with those studies, or I thought, was that they looked at each factors individually. So we thought, well, we miss out a lot, because a lot of times, and we had some lectures initially, especially by the keynote speaker, that you want to include all the components involved. And if you just look at one factor at a time, but not the relationship between factors and how they play a collective impact on individuals' perception. So we decided to do a study using the socio ecological model, because that way we can incorporate a lot of factors, look at multi-level influences on perception, and also the relationship between individual factors. So that way we'll have a collective impact, or what would be a complex relationship between factors that influences one's perception of the law. So we decided to use the CDC's 2007 SEM model, which is interpersonal, community, and society. And we had three hypotheses. Number one is there a difference between the perception of the employers and the perception of the employees? Because studies shows that employees are supposed to benefit, so they will have a positive attitude, versus employers, they think they will be paying more premiums, so they will have a negative attitude regarding the law. So we decided to test that. Also, to see to what level each socio-demographic factors that we are studying actually impact, what is their impact level on the perception regarding the law. And the third one is there a difference between self-reported knowledge regarding the law versus the actual knowledge? Because a lot of studies says, or their literature review shows that even news media will say, people don't understand the law, and so we need to educate them. And so we decided, well, let's test it. Is it really education? That do they not know, or do they think they don't know but they know more? So we decided to test these hypotheses. Our method was an online survey, a cross-sectional study. Based on the literature, we created a questionnaire, 29 questions, looking at job status, insurance status before and after the implementation of the law, self-reported versus actual knowledge regarding the law, the perceptions. There were questionnaires that tested that. Also, for employees, we also asked them their intent on purchasing the insurance if the employer doesn't provide, to see how agreeable they are to the law, and then the socio-demographic information. And the surveys were open to employers and employees throughout the country. Methods. So we set the statistical or significance at 0.05 level a priori. We used the R statistical package for the analysis. And to test the hypothesis 1 and 3, we used the Kendall tau correlation, and I'll go more in detail because we did not have a large survey size, so we decided to do non-parametric testing. So we decided to do Kendall tau correlation to test it, and then use the bootstrapping methods to improve our accuracy, I guess, of inference. And then for hypothesis 2, which was more of a complex model, we used the structural equation model to see the impact of each individual socio-demographic characteristics, as well as a overall based on the multiple levels. And I'll go more in detail in results section. So SEM, social or structural equation model, is a combination of two things. The first thing is the measurement model, where you define your latent variables. These are like testing intelligence. There's no right way of testing it. So we use other things. You can't directly observe it. You use observational variables to test it and then make the inferences. So that's what we did with that. So our results, our time frame was from November 2014 to December 2014, which is the holiday season, very busy end of the year. So we were lucky to have 32 participants, and out of them, only 27 qualified for the study, because 2 did not give the consent to the study and 3 never completed the whole survey. So we ended up getting 6 employers and 21 employees for this study. And this is the socio-demographic characteristics by the employment status, whether you were employees versus employers. And results, so for the first hypothesis regarding the perception of employers and the employees on the law, we found that, as expected, that employees had more positive perception regarding the law than the employees or employers did. So there is a job effect on the perception of the law. Regarding our hypothesis number 3, which was the association between self-reported knowledge regarding the law and the actual knowledge regarding the law, we found that there is a statistically significantly negative correlation, which was very interesting, I thought, because that indicates that people knew more about the law than they thought they knew, which contradicted with the literature, and what the media suggested. And we'll talk about implementation in a few minutes. This is the using the structural equation model, we were able to create this diagram, which, again, this was very interesting for me because if you look at the significance, so there were 4 levels of the SEM, the intrapersonal, which is the within like the biological characteristics, versus the interpersonal, community, and society. What we found was that interpersonal significantly impacted the perception followed by community level, and then the society. However, the intrapersonal, like your own personal characteristics, did not really significantly impact your perception of the law, which was very interesting. So implications of this study is, if you look at the first hypothesis was as expected, so there was not much, but for the looking at the second hypothesis, we found that interpersonal was very much significantly impacting your perception, followed by community and society. And that tells me that, okay, in the future, if I'm going to have strategies to successfully, convince people to like the law or implement any kind of intervention, if I have limited resources, my best bet would be to focus on the interpersonal level, to have strategies impacted there, then community, and then society, as opposed to targeting individually or targeting the interpersonal level. So if I have limited resources, I'd rather focus them on the interpersonal level to impact the perception of individuals. And then for the third hypothesis regarding the self-reported knowledge versus the actual knowledge, again, literature showed that the media suggested focus on the education component. However, our study found that people knew more about the law, so maybe besides education, in addition to education, we should focus strategies or interventions at other, use other approaches to address the issue. That it's not the knowledge alone that's a problem. There are other factors that we need to address as well. And the strength and limitations, biggest limitation, sample size, only 27. The strength, though, however, is that even with 27 samples, we were able to get diverse beliefs and socio-demographic characteristics. Our participants were very diverse, so that was quite representative of a bigger group, I would say. And also, like when we did the bootstrapping for the Kendall talk, like regarding the self-knowledge and the actual knowledge, each time we had the p-value below 0.05, which is very significant. And also, this is a first time. We are not aware of any other studies that have looked at all characteristics, socio-demographic or other factors, and their impact collectively on the perception. So this is a very novel idea, I would say. Future direction, definitely this is an ongoing study, so we would like to have like a larger population, and also improve the model by incorporating more information as we learn more. Right now there is not much information regarding the law because it's relatively new, so it would be nice to continue to change the model to incorporate more information and see how it impacts the perceptions and hence the acceptance of the law. So in conclusion, individual perception is very important. Social marketing, it's a huge thing, so we should not neglect it. And definitely our study showed that perception more significantly impacted at the interpersonal, community and society level, not so much at the intrapersonal. So focus should be on the other levels. And SEM, or the socio ecological model of affordable care acceptance, is a powerful tool to, one is to look for, identify barriers or facilitators to successfully implement the law, and to use the information to address any deficits in the law, because the first time nothing's going to be perfect, but it's our job to improve it, and we represent a group, so we have to bring out the problems that our workers or employers face and bring it to the attention of the government. And these are my references. I would like to acknowledge Sunshine ERC for funding my MSPH and also for this study. And my committee member, my thesis committee member, Dr. Hamisu Salih, who was my major professor, and Dr. Tom Trunkell and Dr. Tom Bernard were my committee members, and all the individuals who helped me make this a reality. And this beautiful flower, the picture was actually taken at the Utah President's Circle. Beautiful. So thank you for hosting this, and we really greatly enjoyed it. Beautiful view. Thank you.
We have time for some questions. Looks like there's one in the back.
Oh, yes.
Actually, a two-part question.
Okay. Sorry.
I assume you intended this study to be generalizable to public perception of, is it any law or is it healthcare laws?
Okay, it was basically mostly focused on the Affordable Care Act law regarding the small businesses.
Okay.
So it was mostly for employers and employees, and I didn't go much in detail, but it was we focused on employers who were going to be affected by this law, and according to the law, if you have 50 FTEs, full-time equivalents, then you're mandated to provide insurance to your employees. So we did not look for employers who had less than 50 FTEs.
So it sounds like stratification was a major part of this. So then it sounds like the study wouldn't be as generalizable to say something like how the public accepted HIPAA. I personally think HIPAA was a major legislation, but I've never heard any dispute.
Right. And that's interesting because I've heard, even for Medicare and Medicaid, when it first came, there were a lot of oppositions, and I think part of it is because this law, Affordable Care Act, is 2,700 pages long.
Yeah.
And I don't understand the language of the lawyers, so we have to convert it. There you go, right? So we have to translate it into layman's terms, which they have done a good job. There are videos you can find on YouTube that simplifies it, and which I can understand then, But it's, again, nobody knows. We have a lot of projection of which direction it will take us, but we don't really know the impact until we give it some time and then evaluate how it's going to impact us. Yes, sir. Yes. So our questionnaires, we had 4 questions, both for employers and employees similar, which asked for, we had 6 statements that were regarding the law that we got from the law, and then we asked true or false questionnaires based on that. So that assessed how their actual knowledge was. So if they identified the right statement correctly, then we assigned them a score, and then at the end of each 6 questions we added the numbers, and then we calculated the mean. So that was how the actual knowledge was. And then the self-reported was based on, there was one question that asked them, how would you rate your knowledge regarding the law? And then it was on a Likert scale, so we converted that to a scoring and then calculated that. Did that answer your question? Right, so for self-reported is like, if somebody asked me, how would you rate it, I would say excellent. So you would expect that, okay, I feel comfortable with my knowledge regarding the law. But then when we tested them on the facts, it would give you more accurate information about exactly how much they knew, which we found was interesting, that they knew more than they reported that they knew. Didn't expect that. Yes, sir. Exactly, right? I agree. So I feel like before we reach any conclusion, it's better to give it some time, because it was intended for something good, necessarily. So, all right. Yes, sir.
How did you recruit? It was open to 150 million workers.
Yes.
At 27. Was this a convenience sample, or how did you recruit?
No, it was quite the opposite, I must say.
Okay.
So I'm glad you asked that question. I had to get rid of that. So initially, we send the emails, the recruitment emails, to 300 plus businesses across the country, and we got 0 response. So then I talked to my advisors, and I contacted ACOM, which is the National Occupational Environmental Medicine Society. They helped pass the question or the recruitment email to their members. Also, we consulted the local USF OSHA consultation group, because they do have courses for the small business owners who are their students, to see if they can help pass on the survey on a voluntary basis. And it was quite. Part of the reason I think we had such difficulties was there was no incentive. I didn't have money to give out or anything for them. Also, it was end of the year. It was November, December, which is time for holidays. People have projects due, end of the year things. So it was not a sample of convenience for sure. It was, if anything, it was otherwise. So, but it was, luckily we had good diverse group. So, yes, sir.
So do you guys have any strategies for, I think it makes sense that people, these interpersonal communications usually more effective if you trust the guy next to you.
Yeah.
Unless he's really kind of similar from another university.
That's right.
So do you have some strategies to get that information down to a personal level where people can digest it?
I think, and again, I got rid of the information, but part of this, I think once we have more, maybe test this information on a broader population, and if we still get the same result, one of the things I was thinking was adding your healthcare providers' perceptions too, because if my doctor tells me or my health practitioner tells me something, I will trust that person that, they might know something that I don't, and my perception will go with theirs, And I think also local communities, and your employers, really, first of all, we need to get them on board about what this is all about. And then, because I know as a resident, when we go to local hospitals, they have already started using more preventive, their health insurance now is more focused on prevention and educating their employees, and their policies have been changed because of the rule or the law. So it's already started, we just need to, so I don't have any information right now, but I was thinking maybe healthcare providers and your employers would be a good place to start. All right. Okay.
Good, thank you. If there
Thank
are
you,
other questions,